The guy told me that half of the heart is not working.
Yes.
I stood up and all of a sudden I felt I was drowning.
I have pain under my testicles.
Under your testicles?
Yes, just on the left side of the testicle. That is where I do have the pain.
When was the last time that you had sex?
It's a month ago.
Was it with a regular partner?
2 people besides this girl, but they're all regular. Oh God, getting pain, getting worse and worse and worse. I can't understand it no more. I can't even sleep.
Good morning, surgery.
Good morning, St John's. Can I help you?
Could you come for this morning, 9:20?
Your breathing seems a bit better.
It is.
Good.
So I've had a few days where I've gone and not had any cigarettes, but then there's been other times where the craving's just been like so much that I've had one, but after a couple of, just took a couple of pulls and thought it's disgusting and kind of just got it out of my system.
Where are you getting the cigarettes from to have the odd one?
Well, it just happens to be a drawer.
Right. Which I'd like you to go home today and have a ceremonial emptying into the bin.
That's the fear bit, because I'm thinking, what if I really, really do need one?
If you were addicted to heroin, would I say to you, go and just put 5 ounces of crack heroin or whatever in your drawer just in case you need it? Would I say that to you?
No.
So why would I say that to you with cigarettes?
You wouldn't.
No, you wouldn't, would you?
I'm saying it to myself.
Again, it's another thing. You're setting yourself up to fail.
Okay.
So get in there and be positive.
I will do. Promise you.
Right.
I'll go home and get rid of it.
Get rid of it.
What's the date of birth?
8/10/35. No, just sorry. 8/10.
Can you bend forward and touch your toes for me? Great.
Ow!
And up.
Sharp pain. It's like every time I move, stabbing me.
How severe would you score it on a scale of 1 to 10?
I would say 9.5.
How much movement have you got in this arm at the moment?
I have movement in it. Ouch.
Hello, sir. Good afternoon. Go on in. How's 2014 been treating you so far?
Well, in December I spent 16 days in Lewisham Hospital
Very sorry.
and now I'm on oxygen,
You're on oxygen at home now, are you?
16 hours a day.
So how are you finding that?
Oh, there's been lots of funny things happen. Your nose runs. Initially it was bleeding, my throat's gone. No, it was not very funny, really.
No.
Not at all.
It's not a nice thing to happen.
What shocked me was they said I had pneumonia.
Well, yes.
And I'd come down with a cough, and I had pneumonia and a heart attack. But it was the breathing bit that got me, because I don't know what it's like to drown, but by golly, that was the impression I got on that Friday morning.
Yes.
I stood up, and all of a sudden I felt I was drowning because I was trying to grab air, and my hands were going, trying to. It's frightening.
I think my biggest frustration is feeling that I can't help my patient because their problem is too complex. But the key thing that we do is we listen and we try to understand what problems that the patient is coming to us with, and we try to work with them to try and find the best solution.
The guy told me that half of the heart is not working. And it's not being able to pump the blood round so it's, the lungs are not functioning properly to do the job.
Well, look, put the jacket on. Let's have a listen to your chest and see what's happened. See what's going on. Deep breaths in and out for me, Brian. Good. Turn around for me. Let's have a listen at the back as well. Okay, deep breaths in and out. Good. Have a seat for me. Your chest sounds good. It sounds clear. You're getting lots of air in there, and so that sort of ties in. You can breathe. You're not feeling short of breath. That's all very positive. I imagine that the cause of a cough is the oxygen. It's drying things out and making you more likely to cough. I think the heart failure nurse is the right person to ask about getting reassessed to see if it's really needed or not, because it sounds like it may not necessarily be needed.
God, it's been a long 6 months, and I'm quite honest with you, it did bring me down.
Yeah.
And no one seemed to care anymore. I still don't, but what the hell?
Right.
Anyway, doctor.
All right, Brian. Nice to see you. Take care. If you're having problems, call me, yeah? You don't have to always come down. Just give us a call.
You take care, mate. Bye-bye.
Bye-bye.
Make sure you're doing enough weight-bearing exercise, walking, skipping, running, whatever you want to do that's weight-bearing.
The symptoms are classic of asthma. Nocturnal wheeze, chest tightness.
It's positive. You're pregnant, my dear.
We're talking about signs of serious infection. Drowsy, dopey, can't wake her, or the opposite. Hey, what's that? What can I do for you today?
For the past week or so, I've been getting really bad headaches. And then it kind of started to get worse Monday when I started to get migraines.
So when you say it started as headache and then became migraine, what do you mean by migraine?
Migraine as in severe pain either at the front or the side of my head, and I usually always end up throwing up.
Is it a constant headache or is it coming and going?
It's a constant one. It's been constant since Monday.
At its worst, what sort of state does it reduce you to? Are you having to get into bed and...
Yeah, literally, I will be in bed with the duvet over my head.
Okay, and any other symptoms like cough, runny nose, diarrhea?
Diarrhea, yeah.
You had a bit of loose stool as well?
Yeah.
Okay. One more question. Is there any chance you could be pregnant?
Morning surgery, Stacey speaking. How can I help?
I have to see a doctor tonight.
Yeah, I will ask the doctor, but you are 35 minutes late and you may have to rebook.
When was the first day of your last period?
It was the middle of last month.
So that would make you a little bit late, maybe? Do you often miss periods?
Yeah, because of my pill.
Oh, right, okay.
Yeah.
And are you pretty good at taking it at the same time every day?
Yeah.
You don't forget? No. Just to be on the safe side, I think it's worth doing a pregnancy test. Do you think you could pee for me?
Yeah.
All right, if you take that to the loo and then just come on back straight to my room.
Hello, good morning, surgery. Can I help you?
Seems to be very busy at the moment.
I can see that.
Come in. I think what I'll do is send your urine off. There's just a little trace of white cell, which, you know, in the absence of any definitive diagnosis, and especially you're a bit tender over your bladder, we'll send that off to make sure there's no infection. But it's difficult to say whether the headache is causing the nausea or whether all the diarrhea and nausea is causing the headache.
Yeah.
What we can do is maybe give you some anti-sickness tablets, see if we can settle things down, give you some painkillers, and then see how you get on.
Okay.
Pregnancy test is negative.
Surprise. Don't need a kid yet.
Good morning, St John's Medical Centre. How can I help?
No, as I've explained to you, and I'll explain it again, there is no appointments with Dr Vash till Wednesday.
You're breaking up. I can't really hear you. I'm getting an odd word here and there.
I can't hear you properly, sir.
Do you know what? I can't hear you at all, I'm afraid. It's a very bad line.
You can have 3:40 or 4:20 this afternoon with Dr. Nav. Would you like that appointment?
I'm Dr. Parker. What's the matter with you?
I fell quite badly and I hit my knee, my leg and my ankle. And after, well, it was a bit painful, of course, for the week. But then when I woke up Sunday morning, there was like a blood effusion inside the knee, so it was like all black. I couldn't be sure that if it was
So
because
you fell on the ground?
Yes. And then there was some gentleman kicking me. And I can't be sure if that was because of the fall or the other person.
Your head wasn't injured?
I had a slightly kick as well on my head.
You weren't knocked out?
No. And ankle as well is still a bit blank, but and I think it's still swollen.
Shall we have a look at them, I think?
Sure.
Does your job involve walking or standing?
Yeah, I'm a waiter.
Yes. But is...
I've been working all week and I've been walking. The walking is not really a problem, standing.
It is, yes.
It's
good.
not.
OK, let's pop you up on top here and have a look. One of the things that you ought to do straight away is put some ice on, because it stops the bruising, it stops the damage to the knee. And now I'm going to ask you to take your trousers off. That's a pretty colour, isn't it? My goodness. I'm sorry if my hands are a bit cold. Fortunately, I think there's no fluid in the knee joint at the moment. If I move round here, is that hurt? And what about the back? Is that all right? No. Now, I'm going to take it like that and I'm going to twist it. OK, now, I'm going to just pull on your leg. And I'm just going to push.
It's okay.
Look, I think this is just bruising. That means soft tissue injury, no broken bones. I don't see any reason for sending you for an X-ray. So I think that's just going to get better on its own slowly.
Come in. Hi, Mr. Lemon, good to see you. Sorry I kept you waiting such a long time.
Is it possible to get a glass of water or I feel a bit faint?
Yeah, sure, take a seat.
Something really light-headed.
Not a problem, you take a seat there, I'll be with you in just a second. I've got a patient with me, but
Oh, right.
you can bring him in.
OK, I'll move them into my room and then I'll come into your room when you're finished, all
OK.
right?
I feel really peculiar all of a sudden, I don't know why.
Have you been feeling like this all day? Is that why you've come to see me, or has it just happened now?
No, it just happened out loud. I just come over and I feel like light-headed.
OK. Ever had an episode like that before?
No.
Ever fainted?
When I cough too much, I faint. I pass out, which has happened, I don't know how many times, but...
Any feeling of your heart's racing at all?
No, but I'm getting all hot and I feel a bit sweaty and cold and I don't know.
OK.
Very odd.
Do you mind taking your jacket off in a minute so I can just check your blood pressure? What was it that actually brought you here to see me today?
I'll need my doctor's certificates run out and I need some of my tablets, some more tablets. Oh, sorry, I feel really strange.
Just relax. OK, just roll your sleeve up for me. OK, do you mind just standing up for me? If you stand like that... You do?
Yeah.
And is it a definite dizziness, or is it the actual room spinning?
I feel light-headed. I don't know, I can't really explain it.
Sorry, let me just get this.
I've been sleeping funny as well. I haven't been sleeping too well.
Do you find yourself falling asleep? Like at times when you wouldn't expect to fall asleep?
Yeah.
Do you mind just sitting on the edge of the bed for me? And anything else changed in your life over the last couple of months?
No.
No? Got into any bad habits? Drinking too much, or...?
I do drink beer every day.
How much alcohol do you drink?
About 5 cans, 5, 6 cans.
5, 6 cans. Of what kind of drink?
Stella.
Stella. So that's, what is that, 5.4% or something?
5.
5%? OK. Would you consider that too much alcohol. Do you know that's bad for you?
No, it's too much alcohol.
How long have you been drinking that much, do you think?
I don't know. A long time.
6 months, a year?
More than that, probably about 8, 9 years.
Do you drink alone?
Yeah.
Okay. And do you live with anyone else?
No, it's by myself.
Okay. Do you mind just sitting down, lying down flat for me?
Yeah, there's a little bit of pain there.
There?
A little bit.
I think, if I'm honest, I think there's a few factors. Did you have 5 lagers last night?
Yeah.
I think if you've been drinking 5 lagers, cans of lager every night for 9 years, you guarantee you've done damage to your liver.
Yeah.
Giving bad news to anyone isn't an enjoyable part of the job, but unfortunately it's something you have to do on a regular basis, and there's no beating around the bush. You have to be completely honest. It's definitely a regular part of the GP's job.
If someone drinks that volume every day, you can't just suddenly stop because you can get into problems with withdrawal. But you certainly do need to cut down, and that might be changing the routine from 5 drinks a night to 4 drinks a night for a period of time, down to 3 drinks a night, and take it from there. I can't tell you that you want to stop, but if you feel like you're ready to stop or you want to think about cutting down, these are the people that are going to be able to help you. I mean, does that sort of scare you, or does it stress you out, or what are your thoughts on what we just spoken about?
Yeah, it does kind of scare us, because I know I'm drinking too much. But I think it's just because I'm always in my room, my bedroom. I never go out, I never do anything. My legs always get giving away, or one day it's okay, the next day it's not. I think it's just that, because I've been like stuck in the house for like nearly 2-3 years now. You know, not been able to do anything except go out now and then, but not as much as a normal person would for my age.
I'm sorry you had a tough time lately, but I'm glad we've kind of stumbled upon it almost by chance, because it means that we got the opportunity now to try and improve your situation a little bit, not just with your health, but also with, you know, how you feel in yourself and your outlook in life in general, really. Our priority now is to get the blood test done, sort out, see where we are with the liver situation. But next time I see you, hopefully you'll be able to tell me that you've cut down a little bit, and then we can take it from there.
Any alcohol?
Yes.
On average, what would you drink in 1 week?
Probably 5 or 6 pints of beer, I'd say.
Would you have 8 or more drinks in one sitting?
8?
Yeah.
No.
When you're drinking every day, the risk can be high, and the liver doesn't tell you it's not well until it's really, really not well.
Good morning. How are you?
What's different to this one and this one?
There's a Meprazole 20 milligrams, and on the back of this it says that this is a Meprazole 20 milligrams. So they're exactly the same, but just made by different companies.
But different colour, that all?
Yeah, but it's because they're made by different companies.
Yeah.
It's like Coca-Cola and Dr. Pepper.
Exactly the same.
Pretty much.
Exactly the same. Dr. Vernon, I can't help it no more, mate. I tell you. Getting pain, getting worse and worse and worse, mate. I can't understand it no more. I can't even sleep.
The likelihood is you have these things called adhesions in your tummy. Remember I said that?
Yeah.
So that's where things stick together, and then you might get some pain from time to time. But it's very difficult to treat that sometimes. The MRI scan's an important part of it, and that will show up if there's anything going on.
I'm telling you, it's very, very painful. It's not only one here. It's here to here, right? Oh, God. I can't even understand it, doctor. I tell you, I bite my tongue up, I will. Because now this one not go away. Not go away at all, doctor.
So the pain's a bit worse than it was
It's
before.
getting worse and worse and worse.
Well, that's why it's important that you've had the MRI scan, and now things will get followed up. In some ways, it's a bit of a pity you missed that gastroenterology appointment that I organised late last year.
I know. Can't help it no more.
Once I have the report, then I can decide where to refer you to.
Yeah.
Okay.
All right. All right, thank you very much, Dr. Bernard, yeah? Thank you.
Bye-bye now.
All right, thank you very much.
Take care.
What might be a good idea is just to announce, you know, that they're running late, so we're not just sitting there waiting.
How your water works? You peeing normally?
A bit more than normal.
Are you going to the toilet more frequently at all?
I do suffer from dribbling.
Yeah.
Does he have any problems with going to a toilet when he goes for a wee?
No.
No, no problems there.
I'm Dr. Trin. What can I do for you today?
I have pain under my testicles.
Under your testicles?
Yes, just on the left side of the testicle. That is where I do have the pain.
Is it there all the time, or does it come and go?
It comes and goes.
And when it comes on, does it feel like aching, or does it feel like stabbing or a shock pain?
Aching.
Aching, okay. Is there any problem when you pass urine?
No.
No, no burning, stinging, no blood?
No, no, no.
Do you ever get any discharge from the penis? Anything leaking from the penis?
No.
Any creamy anything coming out?
When I'm not peeing.
Okay.
No.
All right. I'm going to have to examine you down below. Would you like me to call the chaperone? Yeah. You want someone else in the room?
Somebody else in the room.
Because I'm a female doctor.
No,
okay, I will ask somebody to come in.
Good afternoon, St John's Medical Centre. Sarah speaking. How can I help?
The thing is, the baby clinic finishes at 2:45.
Hello. How much do you weigh? I've got a patient on the line. Her baby is a year old and he's come up with a rash. She's quite concerned about it.
Can you point to where the pain is?
This.
Okay, so it's the it is the testicle.
Yeah.
All right. So I'm just going to examine here. Any pain where I'm feeling?
No.
Okay, all right. That's fine. Let's get you dressed again. There are lots of causes of that kind of aching pain. One of them is an enlargement of blood vessels by the testicle. So I think I will request an ultrasound. What we should do is just maybe do a few more tests. I'd like you to do a urine sample for sexually transmitted infections, just to rule that out. Is there anything you want to ask me?
I was asked to do some tests.
Okay, so they were just some routine blood tests.
Yeah.
Fine, so let's have a look at the results. Your cholesterol is okay, liver function is okay, kidney function is fine, and we did an HIV test, which was negative. The test, however, it doesn't detect if you've picked up HIV within the last 3 months, because it takes that time window for the results to show in the blood.
Okay.
So, when's the last time you had sexual intercourse?
Say a year plus.
Okay, all right. That tells me that as of 3 months ago, there was nothing positive.
Nothing.
So, if you've abstained from sexual intercourse for that time, there's no reason we need to worry.
Okay.
Okay, so once you've had the ultrasound, give it about a week for the result to come back to us, and then book an appointment to come back and discuss the findings.
Okay. Thank you very much.
Okay, my pleasure.
Yes. Yeah.
Take care.
Thank you, bye.
Bye-bye.
Hello, Doreen. Come in. How are you?
I'm not too bad, thank you.
Good. What can I do for you?
I seem to have been bitten by an insect.
Oh, where?
On the leg, I'm afraid.
Doreen, you poor thing. Put your foot up. You need the antibiotics.
Antibiotics?
Absolutely. It's spreading. Look, all that redness. The actual strong red bit's about 3.5 centimetres by 1.5. When did you...
Yesterday.
Oh, good. And that's come from yesterday?
Yes.
Did you feel the little biter?
No, I didn't feel anything.
You never see them, usually, do you? Well, it's pretty powerful, isn't it?
It is.
Now, because that's a difficult part of the body to heal, it means you've got to be jolly careful with it. Try not to bump it, put it up the foot, and watch it. Sometimes it's worth even drawing a barrow mark where the line is, you know, like along here, because that should start to get smaller over the next 2 days. If it's not, you've got to ask to be seen by the emergency doctor, because that's serious. You know, if it's getting very much worse, you're going to need intravenous antibiotics.
Oh.
But hopefully none of this is going to happen.
Okay, great.
Oh, dear.
No.
Now, all you'll hear is different sounds. The slightest sound, Joyce, from this ear. Right. You say yes. Here we go, Joyce.
Okay, and I'd just like to follow my finger, keep your head still. I'm just going to shine a light in your eye, if that's okay? Up and down.
Yes. Yes.
Well done.
What's the problem?
Do you know what the problem is?
Yes, in my throat.
It's got a sore throat
Right.
and a bad cough.
How long's it been there for?
In my throat.
I think at least a week, isn't
About
it?
a week.
Yeah, that's the way.
Let's have a look in your throat then. Give me a nice big like this.
Yeah.
Oh, wow, that's really good. Let's have a look here. Say for me. Beautiful. Good. Everything looks really good back there.
Yeah.
Yeah. Let's have a feel around your neck here. Good. Do you want to just pop your jacket off and let me have a listen to your chest? Right, let's have a listen to your chest then. Okay, deep breaths in and out for me. Excellent. Stay there 1 second, hang on. Right, all right. Do you mind if I check your blood pressure whilst you're here, Tony?
No, that one got quicker though.
That's got the fistlet, all right.
Hey.
Thanks for reminding me.
Can I want Michael?
I'm glad someone knows what we're doing today. Right, there you go. You can watch the numbers go up. Your blood pressure is 123/76, which is perfect.
Michael.
That's perfect. You're very happy with that?
Yep.
So that's very good.
Yay.
In terms of your sore throat and cough, I'm not worried at all. I think it's just a straightforward cold, a bit of a virus, which you're going to get better from all by yourself. Now, as part of our normal tests in looking after your kidneys...
my kidneys, my mum's kidneys.
Your ones.
Your kidneys.
Yeah. And my mum.
And your mum's.
Yeah.
I was wondering if we could get a sample of your urine.
Okay.
Which just means that you need to just do a sample in there and hand it into the reception on your way out. Okay? Was there anything else I could help you with today?
No, I think that's it, thanks.
All right?
Yes, Michael.
Right, okay.
Okay, Tony. All the best. Lovely to see you again.
Yes.
It's okay, Michael. Bye-bye. Bye, Tony.
Sorry to keep you waiting such a long time. Please come and take a seat.
Okay.
So it's been I think I last saw you in December.
Yeah.
When you just got out of jail.
Yeah.
And how have things been going for you over the last few months?
Oh, last month's been more down and up, getting low again, getting very depressed.
Mm-hmm.
I don't know.
All right. Sorry to hear that.
You get to a point you don't want to do nothing, like, you know what I mean? If I'm talking to someone, and the first thing that would come into my head is how can I get out of the conversation without talking to them? And sometimes when I talk, I have panic attacks and that, like, you know, I just burst out sweating and things, like.
Well, last time I spoke to you, we spoke quite a bit about your mood, and you were quite optimistic that things were going to be all right, having got out of jail. Have you been slipping into any of the other sort of bad habits?
No, I haven't been using drugs and it's just stable on my methadone and that, but because I've used drugs a lot in the past, and, you know, when I speak to doctors, I think they think I'm lying sometimes. Does that make any sense to you?
Lying about what?
About the way I feel and that. I don't know, it's just the way I am.
Did you mean specifically about people might think you're not depressed?
Yeah, that's what I mean more than anything, yeah. But
it's not our job to cast judgment or really make those kind of assertions. I have to take what all my patients, regardless of their background, what they tell me, I take at face value.
No, I understand that.
You do have a mental health problem.
Yeah.
Lifestyle change is not easy for a patient to do, and nowadays a lot of people just want a tablet, they want medication, they want sort of recovery to be something passive, but unfortunately it's just not an option. So I think it's really important to give patients time, find out, you know, what they understand about the situation, and make sure there's some kind of plan for them to come back and talk to you about it.
When I last spoke to you, you didn't think that you would ever do anything. I mean, we spoke about suicide and quite some dark things as well.
Yeah.
Are those thoughts that is still not the sort of thing you'd act on, or?
No, I'm not brave enough to do it, if that makes any sense to you.
Are there any other protective factors that you think, other things that stop you? Do your mum or your son come into your thoughts as well?
Only family, really, now, yeah. Do you know what I mean?
I'm glad you don't have the courage to do anything.
Yeah.
But if that ever changes, if you suddenly start thinking you're so low that you think you are going to act on those thoughts, it's vital you come and talk to us. Okay? And if it's not, if you can't get in touch with us, you need to pick up the phone and talk to Mind. I've got a good helpline, or Samaritans have got a helpline. If that's not working, you have to go to A&E because they've got trained psych liaison nurses who are there for that sort of discussion.
I know that,
Okay? And I started you on some tablets as well. Do you take them every day?
I do, yeah. But I haven't taken them for the last 4 or 5 days because I ran out.
It is really important with these kinds of medication that you build up slowly and you don't suddenly stop.
Yeah.
Well, a big part of it is being a bit organised about your medication. Because sometimes when you're feeling low, you lose the motivation to stay organised. But actually, when you're feeling low, you need to be more on it. When do I run out of tablets? When do I see the GP next? So I'll give you some more of your medication. To be honest with you, you've only been out of jail for a couple of months, and from my point of view, whenever I've seen you, I think you're doing pretty well for yourself. And staying out of the drugs and the alcohol, which got you in that situation in the first place, is the main priority.
All right, thank you very much, Doctor.
Take care.
Okay, have a nice day. Thank you.
Bye-bye.
Morning, hello.
How you doing?
Okay, thank you. How are you?
Not bad.
Why am I poking your belly?
Well done. Oh, well done. Right, make sure I've got the right person. Give me your name.
Leslie, James Bernard. Yes. Left arm or right arm?
Now, you're the one that keeps telling me you've got fabulous veins, right? So let's have a look at this one.
Yeah, look, I've done this one yet. It's mostly that one.
Well, let's see, because this is nearest.
OK, here we go.
Anyway, have you starved yourself? You've not eaten?
I had about 12 o'clock yesterday afternoon.
That's all right. But not this morning, because these are fasting bloods, all right? Let me try that one. How's your mum?
She's fine.
Do you live with your mum?
Yeah.
Yeah, I thought you did. So you've got lovely veins.
Ooh.
Right, put your hand on there.
I'm a brave boy.
You are. You deserve a lollipop for that. Now, listen, these go off today.
Yes.
And the results will be back for Tuesday.
OK.
Right. Let's just put a bit of tape on you. Go and eat something decent for breakfast.
Go.
There you go, you're done. All right?
Look at that. Good old arm.
OK, take care.
Thank you very much.
You're welcome, bye.
Have a nice weekend.
And you too.
So the swelling itself only started yesterday, and have you had lots of discharge?
Yeah, I've been bathing with salt water every few hours.
Okay, so if you want to go ahead and use that to... Yeah, that's it. Perfect. And is it painful?
Yeah, the upper eyelid is very painful.
Okay. I'm just going to hold your eyelid up a little bit.
That's painful.
That's painful. Now, does it hurt when you move your eye about? I can't see very well.
I'll try again.
Can you see my finger?
I can.
Keep your head still and just follow with your eyes.
I don't think I can do that.
That's painful. Yeah, OK, you've had no insect bites or anything up there, but you have been unwell with sort of cough and cold symptoms. OK. The sinuses, there's one here called the ethmoid sinus, which is very close to the eye. And sometimes it's possible for infection to spread through. My worry would be, because I can't get the eye open very well and because I can't assess the eye movements, if there is any infection around the eye, if that tracks into the muscles that are close to the eye, we could be in trouble. I think we're going to have to get you over to St Thomas's.
When?
Today.
You're not joking.
No.
I can't do that.
Yes, you can. Why can't you? You're already off.
There is Moorfields.
No.
No, that's a bit of a way away.
No.
This is not a negotiation.
Oh my gosh.
Present this to reception when you get there. So, good luck.
Thank you very, very much.
Hopefully it will be just very straightforward and they can send you on your way and everyone will live happily ever after.
Thank you.
Excellent.
Thanks a lot. All right. Have a good one.
You too. Oh, thank you.
Bye.
haven't got any appointments that have been cancelled today. You'd have to give us something at 8 o'clock tomorrow morning for the same day appointment. No, so you need to phone in at 8 on the date you want the appointment. OK then? Thanks, bye.
Hello. Come and have a seat. Natalie.
Yeah.
How are you?
Well, I've come back, so I'm still getting this real tightness in my chest at night. I feel like somebody's wrapped a belt around my chest and is pulling it really tightly.
On the front bit of your chest?
Yeah, sort of right here.
On that left?
Yeah. I will find that I sort of have to sort of stop to sort of take a breath in.
Is it that you feel you can't get enough air in?
Yeah, that's how it sort of feels. But then when I lie down at night, I get this sort of quite severe sort of chest pain.
When you lie down?
Yeah, it's when I'm lying down.
We doctors always think of the worst things first.
Yeah.
Your pain doesn't sound to me like anything to do with the heart. So we then think about what might be going on in the lungs.
Mm-hmm.
And you've got a normal chest x-ray.
Mm-hmm.
So, you know, I'm thinking, is there something else going on in the lungs?
Yeah.
You would have to speak to the duty doctor regarding that because it's a medical question.
You need to run tests on him because his immune system is amazing. He had exactly what we all had and he's better.
Sorry to burst your bubble, mate. But it's not your amazing immune system.
If I press on any of these bones, do any of these hurt? Going down here. Am I producing the pain you get in that side of the chest?
Yes, yeah, you are. I can feel it sort of...
Coming across there?
Yeah.
But I'm not actually hurting, so
No.
coming down...
Yeah, that's...
Sorry.
It's right there.
And that is the pain you're getting going right across the chest?
Yeah.
OK. Let's turn around, listen around the back. Take a really big breath in and out. Does that hurt?
Yeah.
Sorry. And where it hurts is there?
It hurts like
Round here.
Coming round underneath my breast.
OK, let's come and sit down. And you've had this a long time?
Quite a while now.
Wow. I think some of the problem is a condition which I'm going to give a funny name to, called Tits's disease. Right? There's a joint between the end of the ribs and the breastbone. And for some reason, there is something becomes inflamed, that particular joint.
Okay.
And Titsy's just the name of the guy who discovered it.
Okay. Is there anything I can do about it?
Well, they do say take anti-inflammatory pain relievers. Sometimes physiotherapy can help a bit. So I don't think it's the end of the world. I'm sure we can probably help.
Thank you so much for being so thorough.
That stretches my diagnostic skills, but I think I've got the right diagnosis.
I wanted to do the poo sample and check there wasn't a bacteria in your stomach.
Everything feels normal when you're wiping your bum and... Yeah, OK.
You don't pass jet black sticky poo.
Yeah, maybe.
He's done a poo, hasn't he?
How can I help you today?
My mum just found out recently she's got cancer and that. So I just want to get myself checked out basically to just make sure that everything's okay, really. Yeah.
Tell me what happened with your mum, what she's been diagnosed with.
She went for a checkup and had colon checked and stuff, and they said that she had cancer spreading from her kidney to her lung.
Quite tough then.
I just want to get myself sorted, just checked, just to see if I'm okay, really.
Are you worried that you might have cancer then, or...?
Yeah, because her mother died from cancer as well, so I'm thinking it might be hereditary, so...
How have you been in yourself?
I've had slight murmurs, like when your heart feels like it's Mr. B or something. It's like I've been running, but I haven't.
Do you get other symptoms?
I've been passing urine quite frequently as well.
Because of those symptoms, with peeing more frequently, I just need to ask you a few more sensitive questions.
Okay.
Okay, when was the last time that you had sex?
I say a month ago, 3 to 4 weeks.
Was it with a regular partner?
Yeah, I would say so.
Have you had sex with anyone else?
2 people besides this girl, but they're all regular.
So you're having sex with 3 different?
Yeah, basically.
Do you get any discharge from your penis at all?
Nah, I don't think I've contracted anything like that.
What we can do is listen to your heart and lungs and take a look at your stomach. So sit up for me, sit up. Deep breath in that. And out. Okay, and in. Okay, your chest and heart sound fine. I'll get you just to lie back for me and I'll take a look at your stomach. So just gently press. So it's not painful at all. Okay, your stomach feels okay. And what I'd say is examining you, to me, everything is normal to examine.
Okay.
So that's reassuring.
Yeah.
I mean, you're telling me that you're sleeping with 3 different girls at the moment. That puts you at higher risk of having sexually transmitted diseases. So you need to make sure you're practicing safe sex, so using condom.
Yeah, definitely.
But you are at high risk of the fact you're having 3 different partners. So I could get you to do a urine sample to test for chlamydia and gonorrhea. Have you got details for the sexual health clinic as well?
No, I haven't. So if you've got a number, I'll be very
I can give you details if you want to have a full check.
Yeah, thanks very much for that.
Right, no problem.
Come in. Hello. Come in. How are you today?
Fine. I think Bailey might have chicken pox. He's come up in the little spots, so I just wanted to check to make sure.
Has he been in contact with anybody with chicken pox?
His little cousin has it.
So when was he in contact with it? A week, 10 days ago?
Very recent.
Yeah.
Very recent.
Should we have a look? Oh, yes, we've got some spots on his back coming out. Here. Can you see? They're coming out in little bumps, in blisters first. Then they usually become a sort of yellowy pussy for a little while, and then they become scabby. So have you got any on your head? Let's have a look.
A little bump there, I can see.
Possibly, and possibly a little one there, isn't there? Yeah. Shall we have a look in your mouth now? Hasn't actually got anything in his mouth yet. He's got a wee bit of a temperature. 37.7. Right, the normal is 37.5 and below, so it's just a fraction above normal. I think it probably is going to be chicken pox, to be honest. He's actually infectious 6 days from when the rash comes out. Now, the spots won't have gone by the end of that 6 days, but they will be scabbed over and his temperature will be down. But, you know, he needs to be off school, I'm afraid.
Yeah, that's fine.
Is that all right?
That's fine.
It's a good thing to get it over with, you know. Well, there we are. Champion.
Thank you for your help.
Good, bye.
Bye.
God bless you, Doctor.
Take care.
Thank you very much.
Oh, thank you. Bye-bye.
Bye-bye.
What a good doctor you are.
Take care. Lovely to meet you.
Thank you very much.
Go away. Behave yourself.
Take care. Bye-bye.
Thanks for your help.
No problem. All the best. Take care.
All right.
Take care. God bless you.
Take care too. See you again. Bye-bye.